Good afternoon, everybody, and thank you for joining us again today. Today with me will be Dr. Joseph Canner. He's the Assistant State Health Officer. He will be available to answer any questions that you might have related to the testing and cases and so forth. I'm also joined by Dr. Gina Lagarde, who is a Regional Medical Director for Region 9, which is the North Shore region, and she will be making remarks shortly. Today, we are reporting 1,345 new cases of COVID-19 for a total of 127,246 since the beginning. Those 1,345 cases are on 15,105 tests. I can tell you that 94% of today's cases were from community spread, 6% were from congregant settings, and 94% of these cases were collected in the past week. Those specimens were collected in the last week. Tragically, we've hit a milestone today on deaths. We have now surpassed 4,000 fellow Louisianans who've died of COVID-19. We're reporting 50 new deaths today, and that brings the total to 4,028. And as we have done numerous times since this began, I think anytime you hit a milestone, it's worth doing again, and that is just to remember. Everybody should pause and remember these are our brothers and sisters, mothers and fathers, aunts and uncles. They're neighbors to all of us, and so please lift all of the family members of those who died up in prayer. Currently, we have 1,457 patients in hospitals across the state of Louisiana with COVID-19, and that is down 14 since yesterday. Yesterday was down 16 since the day before. And what we've seen over the last 9 or 10 days are modest but sustained improvements in our numbers related to cases, hospitalizations, and positivity. I can tell you all of those still are unacceptably high, but it beats the trajectory that we had been on for several weeks, and really going back to the Memorial Day activities. So basically from the middle of May, the middle of June, going forward, we're doing better, but we've got some work left to do. I can tell you that we recently completed the surge testing in East Baton Rouge Parish that was sponsored by Health and Human Services, our federal partners. At 48 sites total, there were 56,711 tests administered. Fixed sites will remain in Lake Charles, Lafayette, and Alexandria while supplies last. And in New Orleans, surge testing is now open and will continue past next Friday. Everyone who came to get tested at these surge sites were able to receive a mask, and the Department of Health took the opportunity to educate residents on how to protect themselves and their communities from COVID. Also, because of this surge testing site, really the only testing of any size that we've had in Louisiana that was specifically designed to allow individuals to test whether they were symptomatic or had been a close contact of someone who was COVID positive or asymptomatic. We actually saw many asymptomatic people come in and be tested, and they found out that they were positive. And we would expect that to happen because the estimates are that somewhere between 25 and 40% of individuals who get COVID will be asymptomatic. Now, by the way, that's one of the things that makes this particular public health emergency, this pandemic, so hard to manage and to control. Because these asymptomatic people are much less likely to be tested, to know that they are both infected and infectious, and they will transmit the disease to others, which, by the way, is the very reason that we have a mask mandate in place. The mask is a proxy for a test result. There really isn't another way to manage this disease and try to get on top of the numbers. Now, if you've had COVID symptoms or been exposed to someone with COVID, please get tested. Incredibly important. Call your doctor or call 211 to find a test site near you. At this point in time, I'm going to ask Dr. Lagarde to come up to share her observations with you, and then I will come back up when she's completed. And I would ask you that if you've got questions for Dr. Lagarde, go ahead and ask those while she's at the podium. Thank you.
Thank you, Governor. Thanks for having me here. I'm Dr. Gina Lagarde. I'm the Regional Medical Director for the Office of Public Health, Region 9, which consists of 5 North Shore parishes, and that's St. Tammany Parish, Washington Parish, Tangipahoa Parish, St. Helena Parish, and Livingston Parish. Collectively, we make up about 12% of the state's population. We have over 500,000 residents that call the North Shore home. And the North Shore consists of urban living and rural living. We have cities, towns, we still have villages, and we have over 60 unincorporated areas. It is good, it is nice living there, it's family-oriented, excellent education system, but we still have COVID. COVID is widespread on the North Shore in all 5 of our North Shore parishes. Regarding our numbers related to COVID cases and COVID deaths on the North Shore, our cases and deaths represent about 10% of those for the state's cases and deaths. Regarding COVID incidents, all 5 of our parishes are higher than the federal threshold of 100 cases per 100,000 population. However, the good news is that the mitigation efforts that have been put in place with mandates and some of our restrictions is showing that for all 5 of our parishes, the incidence of COVID is decreasing. And I've seen that over the last 2 weeks. With regard to percent positivity, 3 of our 5 parishes, all 5 of our parishes are above the federal threshold of 10%. However, I'm hopeful because at least 2 of our parishes have shown a decrease in percent positivity. Again, showing that we're going in the right direction for those mitigation efforts that we have in place. Well, we do know, just like the state, in our region, that the age group that accounts for the most significant number of case increases is the 18 to 29-year-old age group. Also, what we do know is that our hospitals have capacity right now. They do have hospital beds. They do have adequate ventilators. They do have PPE. However, their biggest challenge is with staffing. Because again, when we have community spread, the people who work in the hospitals are exposed. And they're coming, and they too have fallen ill. And not all of it is just COVID. Again, keep in mind that, you know, with COVID, there has been fear for people coming to the hospital or seeing their doctors. And so we still have to deal with the other illnesses that we usually see, in our population. What I am hopeful in the region, we continue to work tirelessly to test our constituents. And we work very closely with our parish leadership, with our parish president, our police jury president, and with our Office of Emergency Preparedness directors to find the best place for us to be able to offer the testing in all 5 of our all 5 of our parishes. It is becoming a challenge because, again, we do have some limitations with, the amount of our strike teams that we will have. Right now we're working with, and we're also partnering with our other communities like Oxnard and LCMC to provide that service for community testing. We did have 2 surge sites, one in Livingston Parish and one in Tangipahoa Parish, and we were able to test over 1,400 of our residents there. Collectively, our community testing in the region is slightly over 9,100 tests performed. The average is about 178 tests per day. What I would like to say, we work very closely with our hospitals to ensure that they have what they need to deliver services. We work very closely with our leadership to ensure that the proper measures, mitigation measures are in place. I do want to highlight that we have, community leaders like our St. Tammany Parish President, Mr. Cooper, who just started recently a Mask Ask campaign. Slow the pace, cover your face. It's not too much to ask, wear a mask. And why do I say that? We know that wearing a mask is one of our most cost-effective ways of reducing the spread of COVID. We know that the restrictions and the mandates that were in place have been put in place to prevent the spread of COVID. We are aware that these mandates may affect how we live, learn, work, worship, families. But I think they are necessary to control the spread of this disease. It's not going to go away on its own. And it's a collective effort. It's not just what the individual does, but what we do collectively as a community to ensure that we work towards reducing the spread of COVID. This is my cousin Nadine. Vibrant, 63-year-old, just bought a new home. Enjoying life, retired from Loyola with over 30 years of work experience, rejoined the workforce, productive. March 9th, I think, was the first time we had a case, PUI, in our state. 7 days later, my cousin became symptomatic. She lived in New Orleans, but it was atypical symptomatology. It wasn't that traditional, the typical triad of fever, cough, and difficulty breathing. That did come. Her presentation for 4 days, she suffered with GI symptoms. Again, we didn't know that association with COVID at that time. About 5 days later, she was in the emergency room. The next day, she was intubated. And on April 3rd, she passed away. She passed away on her son's birthday and 23 days before her 64th birthday. So when I hear, I'm sensitive to the fact that people, with COVID, that we've lost our sense of safety, our sense of control, our sense of security maybe. And for some, they feel they've lost their sense of freedom. What I do know that masks work. And so when I hear people say, it is my right not to wear a mask, it is my right to congregate in large groups, what about my right to live? What about your right? I understand. It's about doing what we know is right, doing things right and doing the right thing. This was before we knew this. Reducing large crowds, socially distancing may have saved my cousin. We do know from the contact tracing piece that we were able to possibly connect it to a gathering where others had symptoms of COVID at that time. That could have been it, or it could have been the exposure at work. However, we know that these mitigation efforts work. Masks, it's cheap, $5. The economic impact of that $5 mask, if worn properly, to reduce the spread of COVID versus the cost of hospitalizations, the cost of death, the years of life lost. When you look at the workforce, the 18, and I'm going to say through 69-year-olds, even though I know, the typical retirement age was 65, but I'm going to bring it to 69, we had over 1,400 deaths. Those are years of life lost too soon. That was our workforce. Also, I know we talk a lot about the cases, we talk a lot about the deaths. For those that have had COVID, we know that some of them suffer from the sequelae. They still have issues with their heart, their lungs, their kidneys, their neurological system. There's a cost to that, especially to the healthcare system. We ask that, you wear your mask. That's simple. We ask that you socially distance and not congregate in large crowds. That's easy. We ask that you physically distance at least 6 feet. How easy is that? We ask that you continue to wash your hands, to disinfect frequently touched surfaces. Better yet, stay at home. Better yet, stay at home if you're not well. Those are very, very simple asks to help to reduce the spread of COVID in our state. I wish my cousin had that opportunity to wear a mask. I wish, knowing what we know now, that we had small group restrictions on how many people can gather. I wish that we knew about social distancing then. We may not have been able to save her because we've learned a lot about COVID from March 9th to now. The 4,000 deaths today? No. We can do better than that as a state. We can do better than that as citizens. I'm hopeful because our numbers are improving. It's showing that these mitigation measures are working. So please, what I'm asking is that we mask up, that we socially distance, that we continue our hand hygiene, that we continue to disinfect surfaces, that we continue to stay home if we're not well. You know, I do worry. Our children are beginning school this week. They have the right to be able to go to school and the teachers and the staff and not have to worry about high cases of COVID in our community. Help us to help us. Thank you.
Dr. Lagarde, thank you very much for your work here in the state of Louisiana, particularly in Region 9. And as she mentioned about these mitigation measures working, if you have any doubt, just look at the data. And I know we had a long presentation in here earlier this week with Dr. Bu, but you can see that it was about 2 weeks after those additional mitigation measures were put into place that we actually started turning around those numbers and started showing this modest improvement that has been consistent at least up to now. And one of the concerns that we have is when people hear that we're doing better, they think, well, because we're doing better, they don't need to follow the mitigation measures, when the fact is the only reason we are doing better is because we're getting more people to follow those mitigation measures. And now is absolutely not the time to stop. We need more participation and adherence, not less. Because while we're seeing modest improvements, what we know is if everybody wore the mask, if everybody social distanced, if everybody washed their hands, if everybody stayed home when they were sick, we would see much more dramatic improvement in our numbers. And you know, I would remind everybody we remain red under the criteria of the White House Coronavirus Task Force, which looks primarily at cases and at positivity. Some of you may be aware that today Judge Janice Clark upheld the critical measures that I put into place to slow the spread of COVID-19, to protect lives, to preserve hospital capacity, really to save the lives of Louisianans. This is not the last legal challenge that has been put in place, but I'm confident that I am doing what is necessary, that we are following the science, that we are following the data, that we are implementing best practices and recommendations that come from the White House Coronavirus Task Force and the CDC and so forth, and that I'm doing it pursuant to the authority I have as governor to respond to this public health emergency as I'm authorized to do by the Constitution and by statutory law here in Louisiana. And it's not just that I'm authorized to do it. Because we're talking about lives, I believe that I'm obligated to do these things as well. Doesn't make it easy. I've gone through this with you all many times. Nothing easy about any of the work that we're doing, but it is absolutely essential. It is legal, and we now know without any doubt it is effective. That's not just, some academic exercise. It's not theoretical. We know that it works. We still have significant work to do in Louisiana. You can see that we remain number one in the country in per capita cases. More than 2.5% of our state's population has been infected, has had COVID-19. And again, that's just pursuant to the positive test results, the confirmed cases. We know that there are a lot more individuals than that who've had it, but who have remained asymptomatic or mildly symptomatic and have never been tested. And we also know that if we want, and I think we do, if we want as much of our economy to be open as possible, but safely, as our schools, K through 12, higher education, open but safe, if we want to be able to engage in as much normalcy as possible, it is these mitigation measures that are going to allow that to happen. And we can get to a transmission rate of less than 1 without having to go back to phase 1 or to stay at home, but it's going to require everybody doing their part. That's what the modeling shows. And we can do that. We're on that track now if we can maintain it long enough to get to below 1. But again, if everybody would do their part, we would see much more dramatic results much more quickly. I also want to give you an update on Title 32 in Louisiana, which deals with the National Guard. And we are thankful that Title 32 will stay in place through the end of the year for our National Guard, and we appreciate that very much. The National Guard has been a key part of our strategy. Dr. Lagarde mentioned them just a while ago when she was speaking. And they have done so many different things, from receiving and warehousing and distributing PPE and ventilators and doing testing, going out to nursing homes as part of strike teams, assisting at food banks. I mean, you name it, mobile test sites all over the state of Louisiana. So while we're happy to know that the Title 32 will be continued through the end of the year, I was certainly disappointed to learn that Louisiana and most states will have to pay 25% of the cost of the National Guard for the rest of the year, while 2 states, Texas and Florida, were singled out and not to have to pay a cost share. And I want to make sure you understand, I don't begrudge Texas and Florida. I'm not upset that they're getting 100% coverage. But I will tell you, there's not a rational basis to distinguish between Louisiana and those 2 states when we have ridden the crest of both the first surge and the second surge, as evidenced by the fact that we've had more cases per capita than any other state. And so I will be working through the congressional delegation and re-urging the White House to extend that 100% cost share for the National Guard through the end of the year here in Louisiana. And just so you know, if we continue to operate the National Guard as we have over the last several months through the end of the year, the 25% cost share is going to be about $2.5 million a month. And so it'll be a little more than $10 million is what we're talking about through December the 31st. So it's not an insubstantial amount of funding. I also want to take a moment and talk a little bit about work search, which has been implemented by the Louisiana Workforce Commission. And look, I understand there's some considerable anxiety out there because the extra $600 a week in federal pandemic unemployment benefits has expired. I know Congress is working to see whether they can come up with a negotiated compromise that would continue those benefits at least in some amount. But as of right now, they're over. We know that the state benefit is $247 a week, and people are simply not going to be able to survive on that. It is time to get those who can back into a job and to find work, and there are several thousand jobs available in Louisiana. And so that's what we are trying to do now through the work search requirement, where each week, in order to recertify, the individual is going to have to share with the Workforce Commission the 3 employers that were contacted and that no jobs were available. This also is being done because we are concerned about the solvency of the state's unemployment insurance trust fund, which we've talked about numerous times. That trust fund started out at the beginning of March with about $1.1 billion in it. It's down to $270 million today. We can't pay benefits if the fund is insolvent. The only 2 ways to keep it solvent, absent some funding from Congress in phase 4 of the assistance that they are, coronavirus assistance that they're negotiating right now, is to either cross that threshold whereby the law imposes an increase on payroll tax on employers in order to replenish the fund, or you borrow money from the federal government, in which case you have to put a surcharge on employers in order to assure the federal government that you're going to be able to pay it back. Either way, that's a tax increase or a functional tax increase. We don't want to do that. And so we're asking for help from the congressional delegation. We're working through the National Governors Association and directly with the White House in order to get their assistance on this matter. But these work search requirements are back in place. They do not apply to individuals whose employment isn't available because of a restriction that has been imposed because of COVID-19, or for an employee who actually has COVID-19. So there are some exceptions to this work search requirement. And we do encourage people, however, as they are able to do so, to re-enter the workforce. That's going to be critically important for them and their families, as well as the state's economy. And let's see. I do want to remind people again that the census is going to end a month early, so September the 30th is the deadline to respond to that. It's critically important that individuals do it. We have a response rate that lags the national average, and there will be a price to pay in Louisiana if we don't get more people to respond between now and September the 30th. So we're asking people to do that. It only takes a few minutes to make that happen. So with that, I'm going to pause and take your, oh, by the way, that's 2020census.gov. Go to 2020census.gov, or you can call in at 844-330-2020 in order to complete your census. And so now I'll take your questions. Sam?
Governor, now that you've won in court today, do you have any plans to crack down on the barbecue restaurant in Denham Springs that continues to operate without a food permit?
Yes. We will share that with you when the time's appropriate.
When will that be?
When it's appropriate. Yes. Anybody else? Linda?
On the unemployment trust fund and the solvency discussion, Senate President Paige Cortez said y'all had some conversations about the possibility of maybe using CARES Act funding if there is any left over.
Yeah.
Do you think there's going to be anything left over from either the business grant program or the local government program in a time period that could help keep the unemployment trust fund solvent?
Yeah. I don't see it on the portion of the CARES Act that we've dedicated to local government. There's a certain amount, if you remember, of the $1.8 billion we received, it was my recommendation that, consistent with the intent of Congress as expressed by our entire congressional delegation, that 45% of the $1.8 billion be reserved for local government. The House more or less went along with that, but then did fund $300 million for the Main Street program and an additional much smaller allocation for the frontline workers out of that. But what remains in the local portion of that, we believe, based on our discussions with local government and the filings that they have been making to the Division of Administration, that will be completely exhausted. And as for whether there will be money left in the Main Street program, I haven't received a report yet. In fact, I think it would be premature to guess, because I don't think they're going to start issuing checks there until August the 15th to qualifying businesses. I'm not sure how many applications they've received, how many of those applications will actually qualify, but we should have some idea by the end of the month, I would suspect. That could potentially be in time if there's additional funding there. But if there's additional funding there, I mean, if you think about it, let's just say, and I have no reason to believe this, but half of that money is going to be available. That's $150 million. You've seen the trust fund go from $1.1 billion to $270 million since the 1st of March, and so that would not tide us over for very long. And so the assistance that we need in phase 4 of the coronavirus relief that is being initiated right now is critically important for us, and we certainly would hope that there would be enough money with enough flexibility that we could replenish the unemployment insurance trust fund with that money that would come there. And we're making sure we're communicating that with our congressional delegation. And the Speaker and the President and I have had a number of conversations around different ways to replenish the trust fund, because it's critically important. Nobody wants to see employers have to pay more into that trust fund. But let me just share with you another piece of news. On August the 3rd, we put $12 million into the trust fund. That's the taxes that we got for the quarter. So it's $12 million. I mean, it's just not enough to keep up with the demand with the claims that are being made. Yes, ma'am.
Several other states have temporarily banned smoking in casinos because they're concerned people are taking their masks on and off when there's smoking in casinos. I was wondering if that's been discussed at all in Louisiana.
You know, that was discussed in Louisiana, as far as I know, just now when you brought it up. I haven't heard that, and quite simply, you know, at first impression, it seems to make some sense. But I hate to think out loud, because sometimes you get into trouble. But I appreciate you bringing that up. And the question had to do with whether we should temporarily ban smoking at the casinos where it's not already banned. So I think in New Orleans may be the only place, but I know that Harris in New Orleans, here in Baton Rouge as well, but a number of the casinos do not have a smoking ban in place. But in order to smoke, you obviously have to take your mask on and off. So that's something that I will give some consideration to, and talk to Mike Noel, the new chair of the Game and Control Board. Yeah, but I'm not making an announcement today. I don't know. Yes, sir.
Governor, you've been hesitant to talk about LSU football. You said it's too early to speculate on that sort of thing. I'm just wondering if you've had conversations with LSU leaders about the issue, or if you just haven't even started considering it or discussing it.
No, I have. So I've had conversations directly with the athletic director. And look, we all love, well, I shouldn't presume to speak for everybody. Most people love LSU football, but this is actually broader than LSU, because we have football programs across the state of Louisiana at our universities. But I have had an opportunity to have very good discussions with the athletic director, Scott Woodward. And what I believe, and I think if you look at the entirety of what Virg Alsbury said the other day, they are planning for multiple contingencies as to what they will be able to do safely in terms of the number of spectators they can put in the stands for a football game. And they have a broad range of contingencies that they're planning for, and they don't know what that's going to look like yet. I don't know what that's going to look like yet, but the conversations have started, and obviously you can't make the decision the day of the game. But one of the things that we're going to have to do is get with LSU and other universities and figure out how far in advance of a home football game must they know what they're going to be allowed to do in order to be able to arrange for that. But in the meantime, in addition to how many people they can put in the stands, they are looking at ways to get people in and out and into restrooms and out without having them congregate unnecessarily in close proximity to one another, how they can receive concessions without having to get in line and that sort of thing. And all of that work is going to be helpful regardless, but we're going to have to see where we are in terms of our cases, our positivity, hospitalizations. All of those things will inform what we think we can safely do here in Louisiana when football resumes. And the good news is we do have some time because they backed up the start of the season. I think the first game is September the 24th now, at least at LSU. Yes, sir.
A number of local bars are applying for temporary conditional restaurant licenses so they can continue to operate and keep their doors open in a limited capacity. From a public health standpoint, can you explain why a bar with a duly acquired temporary conditional restaurant license is safer than a bar that does not?
It's really simple. Because they have to operate like a restaurant. All the rules that apply to restaurants today will apply to them in terms of the 50% occupancy, the limit, the need to social distance those people who are not in the same household. More than half of the income has to be derived from food sales, not alcohol sales. And so they would function exactly like a restaurant, which would make them safer. And by the way, that's another indication of the efforts that we're making to allow as many of these bar owners as much flexibility as possible. So it wasn't just the ability to engage in sales for pickup or drive-through. It wasn't just leaving or allowing them to have 2 video poker machines open if in fact they have those machines in their place. But it is also allowing them to function as a restaurant if they're able to do that. And I can tell you they are being, those who meet the requirements and are asking for that permit or receive them very quickly so that they can get into operation and start realizing some income just as soon as possible. But the reason that they will be safer is because they will not be functioning as a bar. And all of their patrons will have to be seated in order to be served and so forth. So it's something that we're doing in an effort. And by the way, working with the Resiliency Commission task force on hospitality in order to do these things to allow as many of these establishments as possible to remain open, but to do so in a safe manner. Yes, ma'am.
Recommendation or protocol for universities in terms of how many cases associated with their campus they have to not have to have people on campus?
So the question is about, is there a protocol of higher education by campus on the number of cases? That's a simplistic way to look at it. What I can tell you is they are working hard with the Department of Public Health, and also CDC is making team members available to work with education leaders, both K through 12 and higher education, to figure out what to do when there is a case and when there are multiple cases and so forth. And I think we can all assume that there will be cases. I mean, you can't have the cases that we have across Louisiana and then resume school and think you're not going to have some of those cases show up at your universities or your K through 12 schools. So it really depends upon how many and whether they are in the same classroom or not, the same dormitory or not. But all of these, I can tell you that just recently our higher education top exercises around all of that. As a result of lessons learned there, they've actually gone back and revised their plans for how they're going to open and operate. And they will continue to do that as they learn from one another and as guidance may change from the CDC and so forth. But I would ask you to direct specific questions about that, either to the presidents of the institutions or the systems, or perhaps to the Commissioner of Higher Education, Kim Hunter-Reid.
Are you all going to report out data based on coronavirus cases at the various campuses? How do we kind of get a university's on the outbreak list?
Yeah. I don't know, and I'm not sure what means we have to capture that information, but certainly what we have, we will share. We're not going to hide it from anybody. But I want to make sure before I say yes, we're going to be sharing information. I don't know whether we're going to be able to capture that through the means that we have in place to update you every day, or whether there's going to have to be some additional things put in place, or whether we would ask you to direct those and to deliver instruction reports with CDC guidelines. And so that's just not something that I believe that I will have to do. Many higher education students, especially those who are vulnerable, are going to be online. Others will do a high. If they have a Tuesday, Thursday class, for example, and they did it in consultation with the CDC guidelines. So I just don't believe that that's going to be necessary. I know she said last question, but you've been patient. I want to.
So in Shreveport, we seeing their third MIC death, and we're seeing do you know about that?
Okay, so I understand you. The third death of what kind? The discussion right now in the medical community about whether this multi-system inflammatory syndrome in children is really just what COVID looks like in certain children who get the disease, or whether it is a separate medical condition that is somehow tangentially related to COVID. And you just indicated that Shreveport has seen their third death. And we've had a number of deaths, and not a big number, not like the 4,000 that we've talked about from COVID, but a much smaller number from around the state. So we obviously are concerned about that, and it is further evidence, if you need it, that children are not immune from this disease. They are much less likely to have a serious illness because of COVID-19, but it still happens. It happens in smaller numbers and in a lower percentage, but it does happen. And we see sometimes a young person will get COVID-19 and have a bad result, even though there is no identifiable comorbid underlying condition. And again, that's not the rule. That is very much the exception. But it is evidence that children are not immune, and so we need to make sure that they are as safe as possible too, which is one of the reasons why the CDC guidelines as we go back to school are critically important. That these kids social distance, that they have masks on, that they stay in their cohorts and they don't intermingle, that they don't go to the lunchroom with every student in the school, that they don't do that at recess and so forth. And that starts from the moment a kid gets on the bus at 6:30 in the morning until the time they get back home. It's critically important if we're going to be able to safely and effectively resume school and get kids back in the classroom. Look, thank you all for continuing to cover this. It is obviously a very difficult public health emergency. One that is going to be with us for some time. Unfortunately, there is a new normal, and the mask is part of that. Social distancing is part of that. Staying home when you're sick is part of that. Washing your hands and so forth. And so we're just asking everyone to do your part and to understand that progress that we've started to see over the last 8, 9, 10 days is positive. But we can lose it. If we do what we did after Memorial Day, we will lose it. And on the other hand, if more people will comply with the mitigation measures in place, we will actually accelerate the improvements that we're making, and they'll be long-lasting. And we can get to a transmission rate of less than 1, so that the disease in Louisiana is on the way out if we will just all engage in these measures. And we can do it without being more restrictive in terms of the businesses that are open and the occupancy limits and all of those sorts of things. So we've got a long way to go, but I'm optimistic we're going to get there. We flattened the curve once before. We're starting to do it again. Now we just need to double down on these proven effective mitigation measures and restrictions. And if we can just all do that, we're going to be in a much, much better place. And we will have fewer people getting the disease, fewer people going to the hospital, and we will have fewer people dying. And that's the quintessential way to be a good neighbor, is to just do something with a modest request of you that's hardly constitutes a burden at all if it means that fewer people get sick and fewer people die. It's just masking up. So thank you, and we'll see you on Tuesday.